Thanks for joining me, Sabine. So my guest today is Dr. Sabine Wünschmann. She's an obstetrician-gynecologist specializing in hormonal health for women. And I'm going to be finding out about, the important link between polycystic ovarian syndrome, PCOS, and insulin resistance, and how managing blood sugar through our diet can help us. So hi, Sabine. I mean, last time I met you around this time last year, and we were talking about your career and your practice and the importance that you place not just on treating, the acute symptoms that many women might come to you for, but also the wider factors, the underlying things that are so important, like diet and lifestyle, to make sure that symptoms don't reemerge. And I know that one of the things that you see in a lot of your patients is hormonal imbalance. And so today I wanted to focus on a specific condition or syndrome rather, that's polycystic ovarian syndrome, PCOS, that is essentially an imbalance of certain hormones. And as with, all of the discussions that we have here on the channel, it's also linked to our metabolic health and how insulin, sensitivity or insensitivity can cause various problems, and how that's linked to how we process our blood sugar in the body. So let's get straight to it. I mean, it's amazing that polycystic ovarian syndrome is one of the leading sort of causes of infertility in women. I mean, correct me if I'm wrong, but I think it's 1 in 10 women who suffer from it, and it often does go undiagnosed because maybe they don't pick up on certain symptoms. So I guess let's start with what PCOS is and defining it, and why we so often hear it as one of the causes of infertility in women.
Thank you very much, Daphne. I'm really glad to be here. It's always, wonderful to support, actions and initiatives that really help women how to connect the dots and help them really, become, the actual driver of their own health and not just, running after symptoms. And I think that is so important that we're here also today, that women really start to learn about their health in a very light way. We don't want to become too medical and too exhausting, but it's important to actually understand the concept of having symptoms and to understand the concept of what to do with them. So, we do not have just symptoms in order to get annoyed. We have symptoms because it's a sign of an imbalance. And as you very clearly and rightly say, polycystic ovarian syndrome is something that is extremely common. It's a condition, that you're born with. It's not something that you pick up because you were unlucky. It's just something that is also geographically more common in the southern European hemisphere, so in the Mediterranean countries like Greece and Turkey and Spain and Italy. It's much more common than in the North European countries. And it's a condition that the ovaries are actually equipped with a large amount of eggs. I mean, I need to maybe make a small excursion in order to explain what the ovaries are actually consisting of. And we as women, which is one of the big differences between men and women, but amongst social differences, the medical differences, that we as women, we are born on the day of our birth with the amount of eggs that we do have in our ovaries. So we have like 350, 450,000 eggs in our ovaries. And these ovaries, they're kind of sleeping, hibernating through childhood. And then puberty starts, and the hierarchying system, the signaling from the brain, from the hypothalamus and the pituitary gland start, and we're started on our way to reproductive age. Every month that we have a cycle, 1 or 2 eggs will be activated. So we have this hibernating pool of eggs. And then, through the release of hormones that get released through the brain axis, 1 or 2 or 3 or 4 eggs get activated to become the dominating egg of the month. One of them usually progresses to become the leading follicle. And then when the follicle reaches maturity, which is usually in the middle of the cycle of a woman, anything between day 10 and day 14, the follicle bursts, the egg will release, and so forth. And this happens again and again. So in the course of our reproductive life, every month we lose a certain amount of eggs. And the way the ovaries are supposed to react to the instructions basically by the brain in order to release the growth of one egg, it needs a certain amount of receptors on the surface of the ovary, so that the hormones that are released into the bloodstream, they hook onto the surface of the ovary, and then the ovary gets the information: we need to prepare the egg, release the egg, and then the whole process starts. These receptors in polycystic ovaries, there are quite different. So these receptors in the polycystic ovarian syndrome, they are I would say lazier. So it's much more difficult for the ovaries to actually get the instruction to ovulate. That's why the cycles traditionally are usually long. Women with polycystic ovaries, they have very long cycles. So ovulation really gets delayed, instead of ovulating on day 12, day 13, day 14, they sometimes ovulate day 25, day 30, or they don't even ovulate when it really becomes into unovulatory cycles. And this is something that, is very classical problem in the polycystic ovaries, that, you do not really get the trigger to ovulate. Ovulation gets delayed. And then, the quality of the egg that gets released eventually is much less. And so comes the whole infertility issue. The infertility issue insists, primarily of slow, delayed release of the eggs from the follicle. And this, will then result in non-fertilizing or not good quality eggs. So that is the pathology of infertility with polycystic ovary. I don't know, is that understood, Daphne?
Definitely,
Do you want
yeah. No, I
to dig a
understand.
little deeper there?
No, I understand the link. Yeah, I think the link with infertility. I'm just curious to find out what are some of the symptoms that manifest themselves. How might a woman realize that she has this?
Yeah, so the difficulty really is in infertility, that you obviously, when ovulation doesn't happen in a timely manner, your cycles become prolonged. So you would experience, as a woman, you would experience very long cycles. You would have, like, a cycle from 30 days and upwards, 30 days, 40 days, 50 days, even sometimes skip a month. So extremely long and irregular cycles. As a result of that, you also experience usually extra hair growth. So you have a condition that we call hirsutism, which can present itself with facial hair, with hair growth around the nipples, in the décolleté, on the back. So you have extra body and facial hair. You have usually very oily skin. You have a tendency to be rather obese. You're a bit more on the chubby side, so it's much more difficult to have your weight in a steady level. You need to really struggle constantly with losing weight. It's very difficult to lose weight. And that's where all the your great effort comes in, because these ovaries, they tend to also with a tendency towards insulin resistance. So it's not only that they have delayed ovulation, they also have increased testosterone. They have a very high LH level on blood tests. And I think one big difference that we should also differentiate, because we don't want women to be scared when they get diagnosed with polycystic ovaries, because very often it creates a great deal of fear. You're diagnosed with polycystic ovary, and then the traditional approaches that they put on the pill, you suddenly controlled by synthetic hormones that you take orally every day. So the function and the the process of ovulation, etc., that happens every month gets totally stalled. And with the use of contraceptive pill, you just take externally your tablet every day, and then you have like a fake period in a way, because you just, when you stop your period, you get a withdrawal bleed. But of course, this is not really addressing the issue of polycystic ovaries. And I want to make very clear that there's a big difference between polycystic ovarian syndrome and polycystic ovaries on the ultrasound. So you have, very often you have a multicystic, polycystic, this is actually a Greek word, poly in Greek means many, and cystic is cyst. So if you look at the ultrasound of a woman with polycystic ovaries, they look almost like a Swiss cheese, and they have this, what we call like a necklace sign, like a pearl, a chain of pearl that we wear as necklaces. They have this as small, polyscystis, as many little small cysts. So if you diagnose just with polycystic ovaries, irregular periods, and oily skin, and very hairy appearance, and weight problems, you're usually not dealing with such a significant metabolic problem. In the sense, the polycystic ovarian syndrome is really when all the things that I said earlier are combined. So you have the polycystic picture on the ultrasound, you have very irregular cycles and long, you struggling with your weight, you're hairy, and you're not ovulating regularly. In that case, women usually have an increased insulin level. They have, a poor sugar balance. They have increased LH and increased testosterone. So it's a bit different. So I think it's very important to differentiate, do I have the polycystic ovarian syndrome, which then also will give me great difficulties to fall pregnant. And if I'm pregnant, to even, gives me an increased risk for miscarriages. Or do I only have the polycystic appearance on the ultrasound, but I have regular cycles and I'm just a little bit more prone to possibly, develop symptoms of insulin resistance. So it's a big difference in diagnosing it. And I think, there's no panic. You understanding the pathology and the way that polycystic ovaries are working, there's a lot you can do with managing your blood sugar.
Exactly. Yeah, I
There's a
was going to
lot you can
ask.
do with your
So
diet.
our aim is to keep our insulin levels in check, right? Therefore, keeping our blood sugar relatively stable. We should be doing that through our diet, I presume.
Yeah, I mean, one of the key things that I usually recommend when patients appear with, all the symptoms that we have said earlier, is really to adjust the diets. You can just start with a low glycemic index diet. Measure your blood sugar levels. Make sure that you do not really go towards insulin resistance. That you make sure that that your diet is very balanced in that sense, that you exercise regularly, that you really help the metabolization of the nutrients that are that are put into your system, are really wisely chosen. And in that sense, a lot of women, that they even they don't even have any problems in terms of symptoms, so they can beautifully heal and clear themselves. I think one of the reasons that it's so important and so exciting that we're here today is really to make sure that people do understand that there's a lot they can do themselves about dealing with a diagnosis of polycystic ovaries, which means that you take care of your diet. You make sure that your sugar levels are balanced, that you don't really have any ups and downs of your insulin curve, that your diet is conscious of that, and it can be managed beautifully in that sense, and doesn't need to be any concern for well-being, because the severeness of the polycystic ovaries is definitely the young age, because, when you are young, you have lots of eggs. Like we said earlier, we are born with the amount of eggs when the time of our own birth. So as we grow older, the effect of the lot of eggs and the polycystic is getting, so the earlier we care, the earlier we don't allow our body to slip into this mode of insulin resistance, the better, because the problem is also that you do not have significant symptoms of that. I mean, other than weight gain, and it's just something that is usually very subtle. It's not from one day to the next you experience horrendous symptoms. So it needs awareness, and it needs really a conscious approach. And one thing that would really help wonderfully is really to measure your blood sugar levels. So that would be a direct parameter of seeing where do I stand and what am I doing with what I'm eating. Am I doing the right thing? We might patients say, "Oh, doctor, I'm eating very healthy. I have every day, my little biscuit, and I have my coffee, and I have a glass of milk." And people think that they're really eating healthily. So healthy eating, helping your body, is also something that would need a lot of education
Yeah, and I mean,
in
each of
order
us
to
reacts.
assist patients to know what they're doing
Yeah, no, I was just going to say that each of us reacts
differently.
differently, but as sort of a general measure and general advice, we should really be avoiding sugar and refined carbohydrates, right? And starch, essentially, to keep our insulin in check.
Absolutely. And yeah, but there we also, that's where we also victims of our advertising, industry around us, because, we get suggestive, icons everywhere, or if it's in newspapers, or in advertisement between, entertainment programs on television. We always get suggested that, eating processed carbohydrates is a good thing, and it's definitely not, because it's really like a sugar tsunami on your poor pancreas. Because if we want to say, what is insulin resistance, it's something that maybe all of you not aware of it. It just basically means, that the fat cells, the muscle cells, and the liver cells, they are not responding to the insulin as much as they should. Insulin is a hormone that gets released from the pancreas, and it's responsible for the uptake of sugar into the cells in order to produce energy for our body. So if I have, like, a sugar load of processed carbohydrates coming in, and my cells can actually not respond to the insulin, that means you have all this sugar circulating in your bloodstream. And if this is happening on a continuous long-term basis, you will end up with increased sugar levels and pre-diabetes and diabetes. And this is something that is totally avoidable if you take your measures in time.
Definitely. And just as a final question, Sabine, I just wanted to ask you, we said that polycystic ovarian syndrome is essentially a metabolic condition. A lot of people think about metabolism and they just think it's about, how quickly or efficiently we burn calories. And in a way it is, but metabolic health is so much more than that. What does metabolic health, mean to you in everything that we've just talked about in this context and in the context of insulin resistance?
I mean, metabolic health is just so much more than just burning the calories. And I think, this is really probably the building block of our level of health is our metabolic health. And, a lot of people, they actually suffering from a metabolic syndrome already, which means that they have high triglyceride levels, or they have, reduced good HDL cholesterol, they have increased blood pressure, they have a large waist, and they have elevated fasting blood sugar. So, it's a team playing, convention of a multifactorial event that metabolism is, and burning the calories is just a tiny little brick of this whole castle of which is called metabolic health. And if you do invest and look after your metabolic health, it's just you just really taking your measures to step away from all these diseases that can be avoided, like high blood pressure, high cholesterol, pre-diabetes, and diabetes, and obesity. So metabolic health is really the symphony orchestra of all of our hormones. We've been equipped with this amazing body that's as a underlying basic strategy has a condition called homeostasis. If my insulin is playing up and is not really doing well, we're suffering from so many diseases. Me as an obstetrician, I see also the increasing incidence of women developing gestational diabetes. So these are essentially young women that they're not diabetic, in nature, and they get pregnant, and through the wrong intake of food and not being conscious enough of what they eat and how they eat, because it's not only the calories, it's also the timing of what you eat, when you eat, how fast you eat, etc. They can find themselves in a situation of gestational diabetes, which means they present with diabetes in pregnancy, which is very detrimental for the imprint of the cells of the pancreas of the unborn baby. So if I'm diabetic in pregnancy and I'm not really taking care of that, the chances of the baby to become diabetic in life is very, very high. And there's definitely, a big increase with the women that present with gestational diabetes. They, as soon as they deliver, the normal incidence is usually that they come out of the diabetes and they become normal again, even though in many cases I've seen also later in life they go back to diabetes. So I always say it's like the sugar and the carbohydrates, the processed carbohydrates. They are this tsunami of an attack on our vibrant health, really. And it needs a lot of effort and awareness. And if you had the means and measure to measure your blood sugar on a regular basis, on a daily basis even, that would be wonderful, because you have an immediate feedback of what you're doing. You just don't wait for your checkup with your doctor, which is once a year, maybe twice a year at the most, to see then what's happening. You can see every day what you're doing, and then adjust and remodel and reinvent yourself accordingly.
Great. Thank you so much for your time.
Thank you very much for having me. Thank you. Bye.